Abby. My name is Caroline. I'm a nurse practitioner student at Averett University.
Okay.
I'm going to do an assessment on you today.
Perfect.
To start out, can you answer 3 simple questions for me?
Sure.
What year is it?
2022.
Do you know today's date?
It's the 18th of January.
Perfect. And who's the president right now?
Joe Biden.
Perfect. Thank you so much. I'm going to start out by assessing some of your cranial nerves
Okay.
and your reflexes.
Okay.
So if you could wrinkle your forehead for me. Thank you. And can you puff out your cheeks? Perfect. If you don't mind, could you clench your jaw? I'm just going to feel the muscles. Perfect. Thank you so much. And then if you could put your hands out straight for me and then press out. Thank you. And then press in. Thank you so much. And then next, I'm just going to see if you can feel the difference between soft and sharp.
Okay.
So I'm going to have you close your eyes. I'm going to start with your cheeks. Is this soft or sharp?
Soft.
Perfect. And then soft or sharp?
Sharp.
Perfect. I'm going to do your hands next.
Okay.
Soft or sharp?
Soft.
Soft or sharp?
Sharp. Soft.
Perfect. And then I'm going to do your forearms. Soft or sharp?
Sharp.
Perfect. And soft or sharp?
Sharp.
Perfect. The next one I'm going to do is your calf.
Okay.
All right. Soft or sharp?
Sharp.
Perfect. And then soft or sharp?
Soft.
Perfect. I'm going to do your lower leg now. Soft or sharp?
Sharp.
Soft or sharp?
Sharp.
Perfect. And then the bottom of your foot. Okay.
Okay.
Soft or sharp?
Sharp.
And soft or sharp?
Sharp.
Perfect. Okay. All right. Next, I'm just going to take a look at your vision just to see if there's any shaking or anything like that. Anything that
Okay.
looks unusual. Make sure that they go in the same direction. So if you can follow my finger. Thank you. Perfect. Perfect. And then I'm just going to bring my finger towards
Okay.
you. If you can just continue to follow without moving your head. Perfect. Thanks so much. I'm going to take a look now with the light.
Okay.
So I'm going to turn off the lights.
Okay.
All right, so I'm going to take a look in your eyes. I'm just going to have you kind of look past me,
Okay.
and I'm just going to take a look and make sure your pupils are equal and they both react to light, and
Okay.
that they accommodate to this light that I'm going to shine.
Okay.
Okay? Perfect. Perfect. So her pupils were equal and they both reacted to the light, they both accommodated. While I'm here, I'm going to go ahead and take a look in your ears.
Okay.
I'm going to pull back your ear a little bit. All right, and I'm looking for the cone of light. I didn't see any lesions or any masses, anything like that, no fluid. I'm going to look on the other side. All right, I was able to see the cone of light again. No masses, no fluid. Everything looks good.
Good.
All right, I'm going to take a look inside your nose as well.
Okay.
Thank you. All right, perfect. Perfect. I don't see any polyps. I don't see any redness. No inflammation.
Good.
You having any trouble with breathing?
No.
No. Perfect. Okay. And then next, I'm going to check out your reflexes. Okay.
Okay.
All right. So I'm going to start with your bicep.
Okay.
So if you could flex for me. Thank you. And now relax. Perfect. All right, again, if you could flex for me and relax. Thank you. And then I'm going to do your triceps. All right. And over here. Perfect, thank you. I'm going to take a look at your wrist. So I'm going to go about 2 inches from here. Perfect. Same on this side. Thank you. All right, now I'm going to move to your knees. All right, thank you. And now I'm going to do your Achilles tendon. Perfect. And then the final one I'm going to do is I'm going to check the bottom of your foot with the sharp side of this. And I'm just going to check to see if your toes curl. Oh, I'm sorry. Perfect. Perfect. All right, Addie, now that I've looked at everything, we've done your reflexes, I'm just going to see how your hearing is.
Okay.
So if you could plug this ear for me, I'm going to whisper over here, you tell me what I say.
Fish.
Perfect. And plug this side.
Apple.
Perfect. And now I'm going to take a look inside your mouth.
Okay.
Any trouble with your teeth or your gums or any
Mm-mm.
pain? Okay. We'll take a look inside. Perfect. All right, so this part's not so fun. I'm going to just elicit the gag reflex
Okay.
to make sure it's okay. Perfect. Thank you. I'm sorry.
You're fine.
And then I'm going to do tongue presser one more time and
Okay.
just ask you to say a word while I do it, okay?
Okay.
Any word.
Perfect.
Thank you so much. All right. And then I'm going to ask you to take your glasses off for a second because
Okay.
we're going to do one more eye exercise.
Okay.
So I'm going to hold down your eyelids if you'll look up for me,
Okay.
okay? And then look down for me.
Okay.
Perfect. Okay. And then I'm going to check your thyroid.
Okay.
So I'm going to stand behind you. Okay, if you could swallow for me. Perfect. I'm going to deviate to the left. Swallow. Perfect. And to the right. Thank you so much. I know that's not super comfortable. And then I'm just going to assess your trachea from the front
Okay.
so that I can see that it's midline and make sure that there's no masses or anything. Perfect. All right, I'm going to take a look at your lymph nodes now. I just want to make sure that there's no pain there, that I can move them all,
Okay.
and everything's going okay. So I'm going to start in front of your ear, behind your ear, underneath your chin, right here in the middle, behind your neck, and right as your clavicle, and right down here. Any pain?
Mm-mm.
All right, I don't feel anything swollen. I don't feel anything that I can't move. Everything seems fine. All right, and then I just have one more weird request for you.
Okay.
If you could stick out your tongue and move it side to side for me. Thank you so much. That was great. All right, Addie, I'm going to have you stand up. I'm going to
Okay.
assess your lungs and your heart.
Okay.
Okay, so first I'm noticing that she's not heaving. There's no abnormality. Both sides are rising and falling normally. So the next thing I'm going to do is just palpate. And if you could just take a deep breath for me. Thank you. I'm noticing my thumbs are moving the same amount of distance apart. One more. Perfect. The next thing I'm going to do is I'm going to just tap on your back a little bit. I'm not noticing any dullness. It's sounding resonant. I'm also going to have you say 99 for me.
99.
Thank you. One more time.
99.
I like one more time.
99.
Thank you. And now I'm just going to take a listen.
Okay.
If you wouldn't mind saying E for me each time I press.
E, 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 E.
Perfect. And it sounded like E, not A, which is excellent. I could hear well. And now I'm just going to listen normal. So I'll have you take some breaths for me each time I tap. Perfect. I'm going to have you turn around so that I can listen to the front. Thank you. All those spots sounded clear. The next thing we're going to do is I'll have you take a seat.
Okay.
I'm going to assess some of your pulses.
Okay.
So the first one I'm going to take a look at is the carotid. So I'm going to feel each side. Perfect. Excellent. Feels like +2 normal. If you could take a deep breath and hold it in for me.
Okay.
Excellent. You can let it out. I'm going to listen to the other side. Deep breath in, hold it. And let it out. Perfect. Alrighty. Now I'm going to listen to, or not listen to, I'm going to feel a couple of your other pulses.
Okay.
So brachial pulse. Perfect. And your radial pulses. They feel equal. I'm going to feel behind your knees.
Okay.
They also feel equal. I'm going to feel the inside of your tibial pulses. Also normal and equal. And then your pedal pulses on the top of your foot. Perfect. And now I'm going to have you lay down.
Okay. This way?
Yes, sorry. All right. And I'm looking, I don't see anything abnormal as far as seeing any visible pulses or anything.
Okay.
Have you had any chest pain? How are you feeling?
No. Mm-mm.
Good, excellent. So I'm gonna feel this left sternal border.
Okay.
Any pain when I press here?
No.
All right, feels normal, no masses. I'm going to take a listen to your heart sounds.
Okay.
All right, got aortic, pulmonic, the herbs, and the fifth one, the mitral. All right, perfect. If you could take a deep exhale, I'm just going to try to feel here your aortic pulse, or apical pulse. Perfect, thank you so much.
Okay.
All right, Addie, I'm going to do an abdominal assessment.
Okay.
At this time, I'm looking to see if I see any abnormalities, any skin issues, any ulcers. One side looks different than the other. Any swelling, I don't see any of that. So I'm going to start by listening to some of the arteries that are in your belly. All right, so look to the aortic. Then I'm going to listen to your renal. And then the iliac. All right, next I'm going to listen to all 4 quadrants. All right, I'm hearing vowel sounds there. Vowel sounds here. And there. And also in the 4th one. So at this time I'm going to palpate your aortic area.
Okay.
All right. Perfect. And then I'm going to do some light palpation. All right. Not feeling any masses. Are you having any pain when I press any of those areas? All right, I'm going to go a little bit deeper this time.
Okay.
All right. Perfect. Still no pain?
Nope.
Excellent. Okay. All right, so I'm going to palpate your liver now.
Okay.
All right, I'm feeling for the border. It feels like a normal size, not enlarged. So now I'm going to percuss.
Okay.
All right, perfect. And now I'm going to go to the other side and check on your spleen.
Okay.
So it kind of hits a little bit deeper. Any pain when I press?
Nope.
All right, perfect.
Okay.
Thank you so much.
Yep.
All right, Addie, I'm just going to test some of your motor function and gait.
Okay.
If you can start by doing this motion for me, your thumb to your fingers. Yep, on each side. Perfect. Looks great. And then if you can walk heel to toe for me just for a few steps and then turn around. Perfect. And then if you'll just walk normal and turn around for me. Thank you so much. All right. And now if you can close your eyes and just put your hands kind of, all right, and neither one of them is drooping. They're staying at the same level. Perfect. All done. Thank you. Okay, Addie, we're gonna test a few motor function.
Okay.
And so the first one, I'm just gonna have you stand on one leg, and your hips are still parallel, so I don't note any weakness. Now, if you can switch legs, still parallel, not noting any weakness, so that's good. The next one we're gonna do involves your shoulders.
Okay.
So if you can hold your hands out and then act like you're holding cans in each hand. Perfect. I'm gonna press down a little bit. Any pain?
Nope.
Okay, and then I want you to move forward about 30 degrees and empty those cans for me. Any pain?
Nope.
All right, well, I don't note any tendon rupture then or any strains or sprains.
Good.